countries across the globe raise awareness of the value of vaccines and also immunization and ensure that governments obtain the necessary guidelines and technical support to implement high quality immunization programs. The ultimate goal of World Immunization Week is for more people and their communities to be protected from vaccines preventable diseases. So to shed more light on this particular story or this topic, I'm joined live in the studio by George Awizinio Lege, a Ministry of Health EPI Director. Also with me in the studio is Basilica Modi from USAID, Senior Health Program Management Specialist Infectious Disease, and Victoria David, Helpful Fund Expanded Program on Immunization Specialist. It's good to have all of you in the studio. Let me begin with you, George. Let's talk about the Immunization Week. Why do we mark this week as the Immunization Week?
Nice. Okay, thank you, Emmanuel. As you said that why been marked? Yeah, the Immunization Week, World Immunization Week. Normally, most of the people know that there is a World AIDS Day, TB Day, Malaria Day. Just left the day before yesterday. So those days was being selected by the technical people to work on it. How? Just one, to emphasize on the importance of that disease. For example, for EPI, why the World Immunization Week? So need all the partners, all the stakeholders to emphasize on the importance of the EPI or the immunizations program. The immunizations, when we are talking about the immunization, especially just the word immunizations, means that we want to immunize ourselves from the disease. For us in EPI, expanded program on immunizations, in South Sudan, we are working on 8 diseases. 8 disease, 6 vaccines. This in routine program. And each vaccine having their schedule, starting with BCG. The child will receive BCG immediately at birth. And
what's that, BCG?
Yeah. The BCG is bacilli vaccines. This is for tuberculosis. Yeah. So, OPV 0 also at birth. Then we move to Penta 1, Penta 2, Penta 3, measles, and we're having IPV. All these vaccines supposed to be finished within 1 year of life to protect the children. When we are talking about the immunizations, means we are doing the immunization to protect our community, our society, our people from vaccine preventable disease. So, means that the aim of the immunizations week for us as a immunizations program to emphasize, to shed more information to the society so that they can know what is the importance of the immunizations.
Right.
I think let me say something in Arabic.
Sure, you can go ahead.
شكرا. شكرا لكل مستمعين بتاعنا في جنوب السودان. يعني احنا قدرنا نتكلم الليلة عن يوم العالمي للتطعيم او التحصين. اليوم العالمي للتحصين هو اصلا ذات اهمية كبير. ليه هو ذات اهمية كبير؟ لانه هنا في برنامج التحصين الموسع مهمة بتاعنا الاساسي ان احنا دايرين نرفع المناعة بتاع أطفال بتاعنا، بتاع مجتمع بتاعنا، بتاع كل الناس بتاعنا المستهدفين في برنامج تحسين الموسع. إحنا وقت نرفع المناعة بتاع الناس بتاعنا، إذن إحنا كنا عملنا حماية للمجتمع بتاعنا من أمراض المستهدف بالتحصين أو الفاكسين. أنهنا هنا الليلة يا جماعة عشان نتكلم كتير في برنامج ده نرفع وعي بتاعنا. احنا لازم نعرف أهمية بتاع بتاع تطعيم. ليه أنا هنا قاعدين نعمل تطعيم؟ التطعيم ده كويس، بيحمي عيال بتاعنا، بيحمي الناس بتاعنا الكبار اللي قاعدين يعني زي في أصلا. هنا عندنا تطعيم بتاع بتاع كوفيد ده لناس كبار، وبالتطعيم بتاع عيال صغار. التطعيم بتاع عيال الصغار يعني هنا عندنا بي سي جي اللي هو التطعيم بتاع تي بي، يعني هنا عندنا بوليو، يعني هنا عندنا بنتا اللي هو الخماسي، يعني هنا عندنا حمى صفراء، يعني هنا عندنا حمى صفراء ما في البرنامج، لكن في كمان في برنامج بتاع تحسين. يعني هنا عندنا الميزلز اللي هو حزبة، ده في برنامج. عندنا الشلل الغير النشط هو حقنة اللي هو اي بي في، ده كله عشان نحمي عيال بتاعنا من امراض الطفولة، ده بطريقة مبسطة.
Right.
شكرا.
Thank you for the explanation in Arabic as well. Now let me come to you, Dr. Basilica. Let's talk about the safety of vaccines. How safe are they?
Vaccines are actually proven to be safe. More than 200 years of research have gone into vaccines since the first vaccine was developed to protect people against smallpox 200 years earlier. And so there is worldwide collaboration on the vaccines production, and there is rigorous testing that happens, and that has led to the development of safe and effective vaccines for more than 25 diseases worldwide. Immunizations save millions of lives every year and are widely recognized as one of the world's most successful public health interventions for disease prevention.
Right. Now, let me come to you, Doctor, once again before I jump to my. Let me come to you, George, before I come to Victoria. George, let's this year I understand World Immunization Week is under the theme "Long Life for All." So, what does it really mean in the context of a country like South Sudan, which is really struggling when in terms of health system? And you are from the Ministry of Health as well.
Okay, thank you. When we're talking about the long life, al-haya al-tawila, you know, in this world, since the creation, if we are following the Bibles, our faithful grandfathers, they live long, 120, 150. So this after a long time, the people dying with the short time because of the issue of the disease. Then now vaccines came in to help to prolong the life. For example, this our grandmothers, if you are asking, they say, how many children you produce? They say, having 15 children. How many of them is still alive? They say 2. Why? Because at that time there is no health service, they are not getting it, and there is no vaccines. And thirdly, if you ask her with what your children been died, they will say, oh, my children was died with the measles especially. So if you are giving vaccines, we are giving life, because the vaccination is the protection. هو عبارة عن مناعة. إحنا وقت ندي الفاكسين إحنا قاعدين نحمي، يعني هو عبارة عن الحماية. أنت لما تلبس قميص، أنت ليه لبست القميص؟ أنت لبست القميص عشان السقط، عشان الشمس. so إحنا وقت ندي فاكسين إحنا قاعدين نحمي، يعني قاعدين نعمل فصل بين الإنسان والمرض. so إحنا وقت عندنا فاكسين زيادة، coverage بتاعنا تمام، النسبة بتاع مرض حينزل. For example, one of the objective of the EPI to have the higher coverage on immunization. هنا وقت عندنا higher coverage, for example 80 above, automatically the disease rate بيمشي تحت. Once the number of the cases going down, means that we're having good life. So our children being saved from the disease. Measles, like what I give. Hasa yomenda nasmiga magadini mutu be measles. Why? Zaman yal be yaninta btalga hella kamel.
No.
Gum findu goha, the whooping cough. The whole village night and day.
Right.
But these days, this thing is not longer there. Why? Because of the vaccine. So the vaccines for protection, protect.
Right, and talking about long life, the CNN reported yesterday from Guinness World Record, the oldest person is 118-year-old nun in France. Let me come to you now, Victoria. Let's come back to our topic of discussion. So what actions do we really need to promote the use of vaccines to protect people of all ages against disease?
Thank you very much. We have taken various actions at various levels to be able to promote vaccines and also to protect people. So I would say the Ministry of Health, together with the key partners, has actually made sure that we have available vaccines at the facility level, because that is one point, that vaccines need to be available so that when people come to be vaccinated, they're able to get the vaccines. So another part that has been done is to train the staff at the facility level to make sure that we have skilled staff who are able to provide these vaccines and are able to also provide the information to the community so that they know when to come for these vaccines and when their next vaccines are scheduled. And at the community level, we also have like Boma health workers, also community leaders who are supporting us consistently with providing messaging on the importance of vaccines. So we've tailored in a way that we have I would say a roadmap, or rather a strategy that we are able to provide this information at the facility and also at the community, where targeting different people from the community and also providing them with very key messages on vaccines.
Right. And let me come back to you, George. Since you're talking about the immunization awareness, how can it be improved here in South Sudan?
Okay, thank you. To improve the awareness, first you have to interact with the community, because the immunizations is something that's happening in the community. It's not in the specific place. So need us to interact with the community, just make a community ownership. This is number one. We need to interact with the community, making the community ownership. This is number two.
And who is to interact with the community? When you say we need.
Yeah, for us in Ministry of Health, because we have a department. The Department of Health, Education and Promotion. They're responsible to raise the awareness of the community, so that they want to interact with the community. Okay. Minister of Health having his partners also, they will work together so that they can able to reach the community. This is number one. Number two, we even the staff, we need to have the skilled, the right person, make a train people so that they can able to disseminate the right information to the people.
Now, if we need to train, why are you not training for the Ministry of Health?
Like I told you, you working with the community. So if you are going to the community, you have to train those who are in the community so that they can able to disseminate. In the Ministry of Health, we're having a department. The department having the staff. It's not enough. This is why we are working with the partners.
Okay.
Yeah, we're working with the partners. So this will help us to disseminate the message in the right time, in the right way. Yeah.
Right. And that brings me to you, Dr. Basilica. Let's look at it from the perspective of partners he just mentioned. Tell us from the USAID side, what has USAID really contributed towards vaccines over the years, if you can take us through, please.
Thank you, Akile. USAID has supported immunization programs globally for many years and continues to do so. This year, USAID's World Immunization Week campaign focuses on 3 thematic areas: innovation in design, equity in access, and action in uptake. So on innovation in design, USAID invests in research that supports scientific advances and technology of new vaccines, like the malaria vaccine that is being rolled out in some countries now. USAID also supports the equitable delivery, distribution, and uptake of new and underutilized vaccines. And USAID works to strengthen the routine immunization services that underpin countries' primary healthcare systems, like in South Sudan. USAID's immunization work harnesses innovation from start to finish, from a vaccine's initial conceptualization to the design of its delivery. In terms of vaccine delivery in South Sudan, under the leadership of the Ministry of Health, partners have used innovative ways to overcome challenges like limited number of vaccinators, bad roads, flooding, by using ways to really get the vaccine to the people. And that is a collective work. When the ministry says, you know, we have to work with partners, it's a huge operation that needs everybody to participate. So partners have come up with ways, especially with COVID-19 vaccine being rolled out now, they ensure that they do more outreaches, more mobile outreaches out to the communities. They use bicycles if they need to, where the roads are bad, but they make sure that the vaccines reach the people. And in terms of equity of access, USA recognizes how critical immunization equity is across and within countries. And so access to basic health services is limited in some areas, and some people who face barriers related to gender, age, or socioeconomic status are at high risk of not having equitable access to vaccine. And US takes that into consideration when programming for vaccine delivery. USAID is partnering with Gavi, which is the Vaccine Alliance, with UNICEF, WHO, and other organizations around the world to help reach the 23 million under-immunized children, of which majority have not received a single dose of life-saving vaccine. USAID has a long-standing partnership with Gavi, the Vaccine Alliance, which has helped immunize more than 888 million children and save more than 15 million lives globally since 2001. And in terms of action in uptake, USAID puts people of all ages at the center of immunization programming.
Right.
Because we recognize that when individuals are fully protected from vaccine-preventable diseases, they can stay in school, care for their families, and contribute to economic growth of their countries. USA turns vaccines into vaccinations by partnering with local leaders, health workers, community volunteers, building trust in and encouraging uptake of essential childhood vaccines, routine immunizations across the lifespan, and COVID-19 vaccine.
And now, Victoria, let me come to you and let's talk about the role of Health Pool Fund after we had the same questions from the USAID side. Go ahead.
Okay, thank you very much. Health Pool Fund provides health services in South Sudan. I would say that Health Pool Fund now is in its 4th phase, and the main program is healthcare, and we are providing healthcare services in 8 out of the 10 states in South Sudan. The program supports about 8,000 healthcare workers, and we are also supporting 577 health facilities at various levels. This is at the primary healthcare units, primary healthcare centers, and also the hospitals. So the program is led by the United Kingdom Foreign Commonwealth and Development Office. This is FCDO, with contribution from the United States Agency for International Development. This is USAID, the Canadian government, the government of Sweden, Gavi, the Vaccine Alliance, and the European Union. This is the EU. So we focus on healthcare programs at the facility level. We also have programs at the community level where we are also supporting Boma Health Initiative. So we are not doing this alone. We are really coordinating with the Ministry of Health and other key partners to make sure that these health services are provided. Thank you.
Right, thanks for that. And Victoria, let me again ask you, do I need to be vaccinated against diseases that I do not, for instance, see in my community or my country?
I would say yes. One needs to be vaccinated even if you're not seeing this disease, because at the end of the day, you are protecting yourself and also protecting the community. So as we look at it, that yes, widespread vaccination led to the eradication of smallpox, and this actually has also reduced world polio cases to a very low level globally. So it is important to get vaccinated because this is the only way to protect yourself against any disease. And since we are not living in silos, we live within the community. So it is also good that you get protected, because at the end of the day, you're also protecting your immediate family members, you're also protecting your community.
All right. So, George, let me come to you once again. Let's talk with adequate levels of hygiene, sanitation, and clean water. Is there really need for someone to be vaccinated?
Okay, thank you. Yeah. We're talking about the adequate level of the hygiene. Yeah, I think the hygiene is something different than vaccination. This is just what I want to say. The hygiene is the behavior. You are living with it. Yeah. And vaccinations is a process also, something different. For example, to protect it with the vaccine preventable disease, first you have to be vaccinated and to be immune. So means two of them are different and are very important. You can do them the same time at the same person. So it's not means when we have a good hygiene, everything is okay, we say no, we'll stop the vaccination. No. Let me give you example. I'm now here, I'm washing my hand, I'm having face mask, everything. And I say, okay, because I having all these things, I don't need the
vaccine.
The vaccines. Okay? After 1 hour, I left this place. I went to the place that is congested with the people. And suddenly, my face mask fell down. Somebody coughed immediately. Means I can contract the virus. Means we have to continue protect ourselves with all measures. This is just what I want to say. Thank you.
Right. And ممكن تقول بس برضه باختصار بعربي قبل ما we give you each last chance before you wind up.
Okay, شكرا. أنا داير نقول لكل مستمعين بتاعنا، طبعا السؤال بيقول هل هو صح علينا بعد ما إحنا عندنا الصحة بتاعنا كويس وإحنا مهتمين بكل القواعد الصحية، صح خلاص إحنا نخلي التطعيم وكده؟ أنا داير نقول لا، إحنا ما بنخلي التطعيم حاجة براو، ولا الإصحاء حاجة براو. ليه احنا دايرين نقول كده؟ لأنه الإصحاء هو بيدينا الصحة النفسية في لحظة معين، والتطعيم هو بيدينا حماية لفترة معين وبطريقة معين. أنا داير نقول لكل الناس إنه التطعيم بيحمينا مدى طويل، أما الصحة بتاعنا أو الإصحاء اللي احنا قاعدين نستعمله هو في بعض من الحالات بيكون في قصور، والقصور ده ممكن تدينا لخطر. عشان كده أن احنا لازم نستمر لكل المعايير والمقاييس بتاع الصحة عشان احنا نكون في يا جماعة في طريقة معافى وسليم. شكرا.
Right, now it's 8 minutes to the top of the hour. Maybe I give you each 1 minute for your last message as we wind up our discussion on this World Immunization Week. Let me begin with you, Victoria.
Thank you very much. I would like to say that we have all the vaccines at the facility level, so I would like to urge everyone to take their children who have not received vaccines to be vaccinated. And just to say that this is an easier way of protecting ourselves and also protecting our community, so let's get vaccinated. And it's a right of that child to get vaccinated, to get the vaccination. So please, caregivers, parents, send your children for vaccination. I also want to say that COVID-19 vaccine is also available in all the healthcare facilities. So if you have not been able to get this vaccine because of maybe one way or another, please make sure that you get COVID-19 vaccine to protect yourself and your community. Thank you.
All right, Vasilika, doctor.
Thank you. أنا داير أشيل الفرصة دي عشان أشجع ناسنا إنه تطعيم ده حاجة مهم جدا جدا. برا هناك يمكن بتسمع كلام إنه تطعيم ما مهم وكده، لكن أنا داير ناس يعرفوا إنه مهم جدا إنه يخطوا الصيغة بتاعهم لوزارة الصحة بتاعنا في جنوب السودان، وما يخطوا الصيغة لحاجات اللي هم بيسمعوها من الناس التانيين. وزارة الصحة يتأكد إنه كل التطعيم المهم جابوه لجنوب السودان عشان ناسنا يلقوا تطعيم، عشان ما يلقوا أمراض السيئة الممكن يوقفوا عشان تطعيم. يعني ده برنامج كبير جدا جدا، ووزارة حقنا يتأكد إنه تطعيمات دي كله يجيبوا لدولتنا، وخلي كل الأمهات كل ناس يمشوا للتطعيم، يشيلوا عيالهم للتطعيم ويمشوا للتطعيم حتى تطعيم الكوفيد الحسا فيه ناس يمشوا عشان ياخدوا تطعيم ده. وزارة الصحة يتأكد مع كل الناس الشغالين معاهم إنه التطعيم اللي بيجيبوه لجنوب السودان ده كله سليم وكويس للمجتمع بتاعنا. شكرا.
شكرا جورج.
اوكي، شكرا للفرصة. أنا نمرة واحد دير نقول لكل المستمعين بتاعنا صفة خاصة الأمهات والأبوات إنه برنامج تحسين المواساة أو ال EPI في قاعد في بلد ده بفترة طويل. يعني زول زي ممكن أنا بقول قبل ما يولدني كان من سنة 70 البرنامج قاعد في بلد. هو مهم شديد. قبل أنا وديت مثال إنه حبوبات بتاعنا ولدوا إيال كتار وإيال دل ماتوا كله بأمراض بتاع شنو؟ بتاع فاكسينز. إذا كان فاكسين فيه أنا متأكد سكان بتاعنا كان هسه سكان كبير شديد علينا زاد ما بنقدر نتحمله. لكن عشان الفاكسين كان ما في وقت داك يا الناس كتار بتاعنا ماتوا وكده. هنا دايرين نقول لكم يا جماعة جيبوا إيال بتاعكم في تطعيم أقرب مركز صحي. هنا يعني دايرين نقول في جنوب السودان كله عندنا أكثر من 1500 مركز قاعد يعمل برنامج بتاع EPI. انت كان مشيت هناك انت بتلقى فاكسين زي قبل انا ذكرت اللي هو الفاكسين الستة اللي هنا عندنا في 8 أمراض ده قاعد. انت جيب عيال بتاعك عشان تاخد تطعيم. ليه قاعدين نقول كده؟ لانه المنظمة اللي قاعد يساعدنا اللي هو جابي هو رفع شعار بتاعه قال احنا ما نخلي اي جنة ورا. No one being left behind. أن هنا يعني نشتغل كلنا إنه كل الإيال بتاعنا لازم يلقى تطعيم. لو إيال بتاعنا بقى عنده تطعيم هو بيصب في شنو يا جماعة؟ في الشعار الحالي إحنا لازم نعيش حياة طويل long life. يعني إحنا لازم نحمي إيال بتاعنا لأن إيال ده يا مستقبل بتاع بلد ده هو مستقبل بتاع الدنيا كله. شكرا.
Well, thank you all. George Auzenio Lege, the Director of EPI from the Ministry of Health, Dr. Vasilika Modi, USAID Senior Health Program Management Specialist, Infectious Diseases, and Victoria David, Health Pool Farm Expanded Program on Immunization Specialist. Thank you all for joining us on The Dawn today.